As a counselor in the drug and alcohol field, I was curious to see how these counseling sessions related to how I counsel and if I would see those sessions happening in general. I don't imagine the brainstorming session to be a good counseling session solely because I feel like he asked a lot of closed-ended questions. Yes, he listened to the client when the client spoke, but I feel like the questions he was asking didn't allow a lot of room for expansion. And he also stated the ideas that client said earlier in the session, but we don't see the part where that was actually brainstormed. So I feel like maybe that context would be a little more helpful if we had seen that. The other two counseling sessions are ones that I can relate to more and can see happening because they use a lot of reflection of feeling and open-ended questions and talk to me about this, which allows the client to expand on what they're feeling and what they're experiencing, as well as being validated because I'm reflecting back and summarizing, hey, this is what you said to me, this is what I'm hearing from you, which allows validation for the client. So the last two sessions, the homesickness and the dancing or helping, seem to relate to each other in that way and are different from the first session, which does not summarize those feelings or those experiences for the client. In chapter 8, I find characteristics and skills that are necessary are being able to listen, being a good listener, understanding when to use silence, because clients aren't always comfortable in speaking, so using that silence, they'll get uncomfortable and then start to speak. Being able to be trusted and show empathy are super important in a counseling relationship, because if a client does not trust you, they're not going to open up. Being transparent and honest are extremely important as well. Not self-disclosing, because that could turn into a counseling session for the counselor, but being able to just be honest with the client, and be there and be present for them. One thing that I have a question about is fear driving that learning. I have a lot of anxiety, so I struggle to find how using my anxiety to grow, how can I do that? Because most of the time I just push it aside in a box and hope that my day goes okay. Another question that I have is, how do I incorporate more techniques versus just the MI principles and the CBT, which is what we use in our facility? I would love to get more information, and how would I go about finding that and incorporating that into my work? And how can I learn to work on the characteristics that are helpful? One thing I did learn from the reading is anybody can have characteristics to be a counselor. They just have to be able to adapt to the situation and adapt to the client, and be able to build that therapeutic alliance and grow in the counseling relationship in a way that helps meet the client's needs.